In 2017, my family lost 3 sisters in less than a year. All of them died suddenly with no explanation. Their brother had died the same way years before. 4 family members total, and as a nurse with 20 years of experience, I should have seen the pattern, but I didn't. Not until my own symptoms worsened and my children started showing the same signs. That's when I finally went on a medical hunt to figure out what was killing my family.
On the road to healing 1 mile at a time.
If we haven't met, I'm Nurse TLC, an RN and public health nurse. I live with Elhers Danlos Syndrome, the same genetic connective tissue disorder that took the lives of my family members. This is a story I've never fully told on this channel, but it's time. Before we dive in, I need you to do something. Grab some tea, get comfortable, and settle in. This one's going to take some time. For a quick disclaimer, I may look down at my notes or take an extra pause or even get a sip of my tea. Sometimes brain fog causes word retrieval issues, and I need just a quick break. Okay, now I'm about to share about the medical mystery that it took 4 family members before I finally got answers. It's not a quick story, but if you're dealing with unexplained symptoms or watching someone you love struggle without answers, this might be the most important 15 minutes you spend today. Let me take you back to 2017, when my world shattered in a way no one saw coming. My mother and my aunt, sisters, died the same night in their sleep, in different states. They were only in their early 60s. The phone call came early in the morning when my stepdad called to let me know my mom had passed. And it wasn't until I called my aunt to let her know that my mom had died that the mystery deepened. When she didn't answer, I called my cousin in Washington, and he said he would let his mom know. I expected a call back from my aunt, but instead got a call back from my cousin, who had said he had also found his mother had passed in her sleep the night before. I remember thinking, this can't be real. This doesn't happen, and no one got to say goodbye. We found out later through their cell records that they hadn't even talked in weeks, but the coroners say they likely died within the same 4-hour window. 6 months later, their sister, my other aunt, was drinking her morning coffee when she just slumped over and was gone. 3 sisters, 1 year, all sudden, all unexplained. And their brother, my uncle, he died suddenly at work a few years before from a stroke. 4 siblings, all gone too soon, and nobody, not the doctors, not the medical examiners, not anyone could tell us why. Then came my cousin in her 40s, had a stroke and lived. My sister was also having strange symptoms, chronic pain, tons of joint injuries, and nerve issues. As a nurse with 15 years of experience at that time, I feel I should have seen the pattern. But I also know with rare genetic disorders, most doctors know very little about them. Plus, grief has a way of clouding even medical training. And honestly, I was too busy managing my own mysterious symptoms to connect the dots. I developed migraines in my 20s, pain in my 30s, chronic widespread pain that doctors couldn't fully explain, plus fatigue that was blamed on chronic fatigue syndrome. Then came the official fibromyalgia diagnosis and dystonia in my 40s. And the involuntary muscle contractions that came out of nowhere, they made my head tilt to the left. It was kind of stuck like this for a while. My pain was unbearable. I had injuries when my ankles would give out, hurt my knee and needed a brace, often needed a back brace for lumbar support. Then came my heart would start to race when I stood up. I'd get dizzy. I felt exhausted, like my body was constantly fighting itself. I had lots of GI symptoms, something called gastroparesis. For a time, I needed a feeding tube. I was no longer able to care for my patients and had to medically retire from direct patient care at the age of 48. Eventually, I was diagnosed with POTS, postural orthostatic tachycardia syndrome, but that felt like just another label, another diagnosis without real answers. What was causing all of this? Why was my body falling apart? That's what I wanted to know. Our family was definitely different than other families, and I didn't realize it at the time looking back. I was living the same confusion some of my patients experienced, a collection of diagnoses that didn't explain the bigger picture. Then my children started showing symptoms. My son had an unexplained leg fracture, nerve pain, dizziness, heart racing. He even passed out. He was eventually medically discharged from the Army. My daughter has chronic fatigue, chronic widespread pain, joint injuries, unexplained rashes. And when they were both diagnosed with POTS, all of this in their 20s, something in my nurse brain finally clicked. This wasn't random. This wasn't bad luck. This was genetic. And if it was affecting multiple generations, my aunts, my uncle, my sister, my cousin, me, and now my kids, it had been there all along, hiding in plain sight, taking my family members one by one. There were other symptoms I didn't recognize because they all had them. It was just the way it was in my family. Things sometimes don't seem abnormal when they are normal for your family. And they all had back problems and chronic pain. And no one could walk very far without sitting down. Looking back, another weird symptom we all had was severe leg pain as children, that doctors would always explain away as growing pains back then. I would get severe leg pains. My mom would put heat on them. I would rock and cry, and it was terrible. My daughter had the same thing when she was little. That's just how we handled it. It was normal for our family because everyone had it. So, but then I would talk to friends who never recognized that and never had that. So it was very odd. I don't know how many people actually get that, but it was very painful. Spent a lot of nights that way. So I went on a quest. I started researching genetic disorders. I looked at every symptom my family had ever mentioned. The joint issues, the chronic pain, the heart problems, the sudden deaths. I read medical journals. I joined patient forums. I even put all the symptoms into AI. And I kept coming back to one diagnosis: Elhers Danlos Syndrome. Because I was already dealing with so much medically myself, seeing doctors every single month of the year, getting so many neurology treatments, I was pretty much bedridden, so I asked my sister and cousin to request referrals to genetics because of their symptoms and to ask if they met the criteria for EDS. This was especially important for my cousin due to her stroke. It took about a year and they both were diagnosed with it. Then this year, 2025, I made an appointment with an EDS specialty clinic and finally got the official diagnosis: hypermobile Elhers Danlos Syndrome. EDS, a genetic connective tissue disorder that affects the entire body. And suddenly, everything made sense. Connective tissue is the glue that holds your body together. It's found everywhere. In your skin, joints and ligaments, muscles and tendons, blood vessels, digestive tract, eyes, organs, and nerves. The fibromyalgia, that's incredibly common in EDS because our connective tissue can't properly support our joints and muscles, causing chronic pain. The dystonia, EDS affects how our muscles and nerves communicate. The POTS, EDS causes blood vessel instability and poor circulation regulation. That's why my heart races when I stand. And those sudden deaths in the family, EDS can cause vascular complications, weakened blood vessels, heart valve issues, arterial dissections, things that can happen without warning, especially if you don't know you have it and aren't being monitored. There is even a very scary form of EDS called vascular EDS. Luckily, that form was ruled out by genetic testing, but due to my family history, I'll be monitored as if I have that form. I know this is a lot. Thank you for staying with me. Wow. And my children's issues? It's likely EDS too, which means they can get proper monitoring, proper care, proper medication, and lifestyle modifications. Here's what haunts me as both a nurse and a daughter. If we'd known about EDS earlier, could we have saved them? Could regular cardiac monitoring have caught something? Could we have known to watch for warning signs? I'll never know the answer to that. But what I do know is this. There are families out there right now living with unexplained symptoms. Mysterious patterns, sudden losses they can't make sense of, and maybe, just maybe, sharing my story can help someone connect their dots faster than I did. That's why I'm here. That's why I'm sharing everything I learn about EDS, POTS, chronic illness management, and integrative healing. Because 20 years as a nurse taught me the medical side, the textbook knowledge, the clinical protocols, the pharmaceutical options. But losing my family and living with this condition myself, that taught me what patients actually need to survive and thrive with chronic illness. It's not just medications, though those have their place. It's not just natural remedies, though I use those too. It's the combination, the both and approach, traditional medicine and herbal support, pharmaceuticals and lifestyle modifications, medical monitoring and healing through nature. It's why I live in this van. I don't know how to with Seiji, who's asleep right next to me right here. Because I've learned that reducing stress, connecting with nature, and having my therapy dog by my side actually helps manage my symptoms in ways no medication alone could. It's integrative healing, and it's what keeps me functional. So if you're watching this and something feels familiar, if your family has unexplained sudden deaths or a pattern nobody can explain, please advocate for yourself. Push for genetic testing, ask for a referral to a geneticist or a cardiologist who understands connective tissue disorders. Don't wait for doctors to connect the dots. You know your body and your family better than anyone. And early diagnosis, it can be life-saving. I couldn't save my mom and her siblings, but if sharing this story helps even one person get diagnosed earlier, helps one family avoid the loss we experienced, then every vulnerable moment of sharing this is worth it. That's literally my mission here, and I hope you'll join me on this journey. And speaking of this journey, living with chronic illness means constantly adapting. What worked last month may not work this month. Your body changes, your needs change, and your space needs to change with it. And if you look around, you can already see a few changes I've made, which is why I'm doing something I've never done before on this channel. I'm taking you behind the scenes of a complete van transformation from chaos to healing space. When I recently got my van back from the shop, it was literally a wreck. So I decided to go ahead and redo it and make it much better and much more in tune with what I currently need. And especially with the seasons changing from hot to cold. So in my next video, you're going to see the real messy process of reorganizing this entire van for better health management. I'm talking about the chaos, the problem solving, the wait. That doesn't fit there, moments of it all. I mean, there's a lot of stuff I had to do, but you'll see it. A lot of it's off camera. I'm super excited to share this with you because when you're managing EDS, POTS, and chronic pain, your living space isn't about looking cute on Instagram. It's a medical tool. It determines whether I have a functional day or I'm stuck in bed. So next time, I'm walking you through my complete van reorganization for fall and winter. It's messy right now, it's real, and it's exactly the kind of practical chronic illness content no one else is showing you. So make sure you're subscribed so you don't miss it. I'm super excited to show you this. After the video after that, I'm giving you the full tour of the finished healing space, including my apothecary reveal, my new apothecary space. Up above here, so I'll show you that. My complete herbal remedy station, how I store and organize everything to make my tinctures, to teas, my Mediterranean diet complete setup, how I'm reorganizing Sagey's area, and how this entire space functions as both a home and my healing tool. Because this is what integrative healing actually looks like in real life. It's how you make healing accessible even when you're exhausted and in pain, which is frequent. So if you want to see the full transformation, the messy middle, and the beautiful result, make sure you're subscribed and have your notifications turned on, because these videos are dropping back to back. And honestly, I'd love your input during the reorganization. Drop a comment right now and tell me what's your biggest challenge with organizing your chronic illness supplies. What would you want to see in a healing space? Because this is a community and your ideas just might make the final setup. Everybody doesn't think the same, so we can all put input in and it might just make it into the video. Until then, take care of yourself, listen to your body, advocate fiercely, and remember you're not alone in this. Sagey and I will see you in the next video. High five. Good girl. We see you in the next video. I hope you can see her on camera. Well, I'll try to get her to give me a kiss so you can see her. Come on, up. Kiss. Up. Kiss. Thank you. Sage and I will see you in the next video. Bye. If you think this video can help just one person, then please share. Thanks. Bye.